NCLEX-RN Practice Test Quizlet Multiple Choice 2026 to sharpen accuracy. Question 1. Nurse Rose is aware that the statement that best explains why furosemide, Lasix, is administered to treat hypertension is: Option A. It dilates peripheral blood vessels. Option B. It decreases sympathetic cardio acceleration. Option C. It inhibits the angiotensin-converting enzymes. Option D. It inhibits the reabsorption of sodium and water in the loop of Henle. The correct answer is option D. It inhibits the reabsorption of sodium and water in the loop of Henle. Furosemide is a loop diuretic that inhibits sodium and water reabsorption in the loop of Henle, leading to diuresis and decreased blood pressure. Question 2. Nurse Nikki knows that laboratory results supports the diagnosis of systemic lupus erythematosus, SLE, is: Option A. Elevated serum complement level. Option B. A thrombocytosis, elevated sedimentation rate. Option C. Pancytopenia, elevated anti-nuclear antibody, ANA, titer. Option D. leukocytosis, elevated blood urea nitrogen, BUN, and creatinine levels. The correct answer is option C. Pancytopenia, elevated anti-nuclear antibody, ANA, titer. SLE is characterized by pancytopenia, low RBC, WBC, and platelets, and high ANA titers, which are hallmark diagnostic markers. Question 3. Arnold, a 19-year-old client with a mild concussion, complains of a severe headache. Which of the following responses by the nurse is appropriate regarding pain relief? Option A. Acetaminophen is strong enough. Option B. Aspirin is avoided because of the danger of Reye's syndrome. Option C. Narcotics are avoided after a head injury because they may hide a worsening condition. Option D. Stronger medications may lead to vomiting. The correct answer is option C. Narcotics are avoided after a head injury because they may hide a worsening condition. Narcotics are avoided after head injuries because they can cause sedation and pupillary changes that mask signs of deteriorating neurologic status. Question 4. When evaluating an arterial blood gas from a male client with a subdural hematoma, the nurse notes the PaCO2 is 30 mm Hg. Which response describes the result? Option A. Appropriate, lowering carbon dioxide, CO2, reduces intracranial pressure, ICP. Option B. Emergent, the client is poorly oxygenated. Option C. Normal. Option D. Is significant, the client has alveolar hypoventilation. The correct answer is option A. Appropriate, lowering carbon dioxide, CO2, reduces intracranial pressure, ICP. Lowering PaCO2, hypocapnia, causes cerebral vasoconstriction, which helps reduce intracranial volume and pressure in patients with head injuries. Question 5. When prioritizing care, which of the following clients should the nurse Olivia assess first? Option A. A 17-year-old client 24 hours post-appendectomy. Option B. A 33-year-old client with a recent diagnosis of Guillain-Barré syndrome. Option C. A 50-year-old client 3 days post-myocardial infarction. Option D. A 50-year-old client with diverticulitis. The correct answer is option B. A 33-year-old client with a recent diagnosis of Guillain-Barré syndrome. Guillain-Barré syndrome can lead to rapid ascending paralysis affecting respiratory muscles. These patients require frequent monitoring for airway stability. Question 6. JP has been diagnosed with gout and wants to know why colchicine is used in the treatment. Which action explains why it's effective? Option A. Replaces estrogen. Option B. Decreases infection. Option C. Decreases inflammation. Option D. Decreases bone demineralization. The correct answer is option C. Decreases inflammation. Colchicine is an anti-inflammatory medication specifically used to reduce the pain and inflammation associated with acute gout attacks. Question 7. Norma asks for information about osteoarthritis. Which of the following statements about osteoarthritis is correct? Option A. Osteoarthritis is rarely debilitating. Option B. Osteoarthritis is a rare form of arthritis. Option C. Osteoarthritis is the most common form of arthritis. Option D. Osteoarthritis only affects people over 60. The correct answer is option C. Osteoarthritis is the most common form of arthritis. Osteoarthritis is the most common form of arthritis worldwide, characterized by the progressive breakdown of joint cartilage. Question 8. Ruby is receiving thyroid replacement therapy and forgets to take her medicine while sick with the flu. This puts the client at risk for which complication? Option A, hexophthalmos. Option B, thyroid storm. Option C, myxedema coma. Option D, tibial myxedema. The correct answer is option C, myxedema coma. Myxedema coma is the life-threatening extreme of hypothyroidism, often triggered by stopping replacement therapy or by systemic stressors like infection.